Hi everybody, how are you? This is Grayscale's YouTube channel and this is Dr. Cecilia. So today we'll be seeing something about lamina dura, which you'll be always familiar with, but still we'll have some few interesting points to discuss. So lamina dura is nothing but it is a thin layer of bone which is surrounding the normal tooth socket, and actually it is a radiographic feature. So on the radiograph it is revealed as a thin white radio opaque line. You can see the arrow mark. So why you see that in a radiograph, even though it is not of any high mineralized tissue when compared to the adjacent normal cancellous bone, but still it appears more radio opaque because of the path of the X-ray beam. Because the X-ray beam passes tangentially several times through the thick layer of bone, so that there is greater amount of attenuation. Attenuation means absorption of X-rays, that is photons. So when there is greater amount of attenuation, you see a thin radio opaque line which is surrounding the roots. So a healthy lamina dura, that is when it is continuous without any break, it suggests that the tooth is vital. It has a vital pulp. But the lamina dura, the appearance can be varying. It can be deceiving. Like sometimes it can be thin, sometimes it can be thick, and sometimes it can not be present. So whenever there is some occlusal overload, maybe due to presence of orthodontic tooth movements and things like that, there can be thickening of lamina dura, where you can see the lamina dura more clearly, and in some instances you can even see that there is no lamina dura. For example, when the palatal root of a first molar is within the maxillary sinus, you will not be able to appreciate the lamina dura in the apical portion of that root. So, and sometimes you can even see a double lamina dura, especially in the lower molars on the mesial side. So when there is buccal and lingual eminence, when the rays of the X-rays pass through the buccal and lingual eminence, you will be able to appreciate a double lamina dura. So these are some of the differences in the lamina dura. So even in cases where there is higher amount of occlusion, the lamina dura will be thick and well defined, and in cases where the occlusal forces are less, you can appreciate that the thin lamina dura will be present, and it also differs depending upon the site. So in the posteriors and the mandibular anteriors, and so depending upon the region and depending upon the teeth, the occlusal forces, the appearance of the lamina dura do differ, but still when it is continuous, it is a healthy tooth, and when it is not continuous, it definitely indicates pathology. So we'll be seeing conditions. So this is like in cases of Paget's disease, you could appreciate that there is complete loss of lamina dura because obviously there is demineralization of the tissue. So there is loss of lamina dura, and for example in case of osteopetrosis, there is thickening of the lamina dura. There is overall deposition of bone, that is thickening of the alveolar bone, which makes it more difficult to appreciate or differentiate between the lamina dura and the alveolar bone, where everything becomes more radio opaque and you will not be able to differentiate between the lamina dura and the normal trabecular bone. And total loss of lamina dura can be also seen in other conditions like malignancies or cyst or hyperparathyroidism, and in cases of again the malignancies like Burkitt's lymphoma, multiple myeloma, renal diseases, Paget's disease, fibrous dysplasia, where it is fibro-osseous lesions, all these things. So in case of osteopetrosis, it is thickening of lamina dura. And you can see thinning of lamina dura in case of osteomalacia, hypothyroidism, hypophosphatasia, sickle cell anemia, and thalassemia. So all these cases there will be thinning of lamina dura. So this is all about lamina dura. Thank you.